Okay, so we have a patient who is admitted to the ED for gastroenteritis. So the order is that we're going to insert a peripheral IV and we're going to administer 20 milligrams of furosemide per milliliter through IV push. We're going to do that right now. So the first thing that we're going to do is we're going to make sure that all of our items here are not expired and that they're still in the correct packaging, and then we're going to go in the room. So first thing we're going to do, we're going to knock, knock. Hello, my name's Lindsay. I'll be your student nurse for today. Is it okay if I place a few items on your bedside here? Okay. So I'm going to place all of my supplies on the bed. Okay. I'm going to put on my hand sanitizer. I'm going to pull up the patient chart. Okay. Can you verify your name and date of birth for me? IV Armstrong, 39964. Okay. And then do you have any allergies, IV? I'm going to give you this. No allergies. Okay, so IV is only allergic to latex. So we're going to go ahead and I don't know if the doctor told you, but we're going to go ahead and initiate a peripheral IV today. Is there any reason that I shouldn't be able to use your left arm, such as mastectomy, lumpectomy, AC fistula, anything like that? Nope. Okay, so we're going to go ahead and go with the left arm today. And then after that, we're going to go ahead and administer that 20 milligrams of furosemide in order to help with that gastroenteritis. Okay.
You want me to leave my turn tape?
I put on my hand sanitizer and my gloves.
Take a red pen. Yeah, I'm reading that. I forgot it. I'll be good. I forgot my 31. It's funny. Okay.
And I'm going to provide some privacy in the room.
I can give you one. I have it. So, next thing.
And then I'm going to make sure my trash can is where I want it.
Oh. And then we're going to find out.
I'm going to wipe down my surface over here. And over here as well.
Did you say you grabbed your medication with your first symptom, right?
Yeah, before you.
Alright. So prior to entering the room, I've already completed my first med check. I grabbed my furosemide from the Pyxis and I have some verified out with me. So I'm going to go ahead and perform my hand hygiene. I'm going to grab my hand.
And Howard's together. When you, I'll give you my floor.
And I'm going to grab all of my supplies here.
This will be clear.
Okay.
Did you have to for the second?
So now I'm going to organize all my supplies in the order of use. So for the IV, I'm going to need an alcohol. The alcohol pads I won't need until later, but I will need an IV start kit with all of my supplies in there. I'll need a saline flush. I will need my needle and then my J-lib. So we're going to go ahead and get started. So I'm going to go ahead and raise the bed up here, Ivy. Alright. So I'm going to bring it up to a good working height.
Okay, so we're ready. Are you ready?
Okay.
For our next
Just a bit more.
file says
Okay, I'm going to go ahead and drop this side down here. Got my trash can ready to go. Okay.
have all my supplies, they're unopened, not expired.
Alright, so I'm going to go ahead and get started here. So again, we spoke with Ivy. We're going to go ahead and do the left arm. There's no reason that we are unable to use this arm, so we're going to go ahead and get started. So in our Ivy kit, go ahead and get it open. Got a few supplies. So I've got my tourniquet, my chlorhexidine, some tape, and gauze. Alright, so the first thing that we're going to do is we're going to go ahead and take our tourniquet and we're going to apply it above the AC here. Okay, Ivy, so we're going to go ahead and get started. So I'm going to pull this up tight here and I'm just going to loop it under to ensure that I have quick access relief. Alright, I may have Ivy pump her hands a few times while I go ahead and look for a good vein. So I'm looking for something that has good bounce to it and is visible. I don't want one that's going to roll, so I'm going to try to prevent that. So it looks like I found a good one right here, and I'm going to go ahead and pop that tourniquet and let it relax just for a little bit while I get prepared. So, all right. The first thing I'm going to do is I'm going to get my chlorhexidine. I'm going to crack it here, and I'm going to shake it. All right. And I'm going to go in up and down motion. And side to side. And in a circle. Alright, so this just ensures that my area is clean. I'm not going to dry it off and I'm going to let that sit. I'm going to go ahead and dispose of that, and now I'm going to get the rest of my supplies ready. So, in our kit here, I have a piece of gauze. Ivy, is it okay if I place a few items on your bedside here? Okay, I'm going to go ahead and ask that you stay still for me, so that way we don't lose any of these items. So, I'm just going to go ahead and place my gauze to the side. I'm going to open up my sterile flush. Okay. I'm going to grab my Tegaderm. I'm going to go ahead and open it here. And place it on the side of the bed. Go ahead and grab my piece of tape. And I always like to grab a piece of backup tape because sometimes it doesn't like to stick. So I'll go ahead and grab another piece just in case. Okay. Now I'm going to go ahead and open up my J-loop. Alright. I'm going to open up this end cap here. Make sure it's loosened. And I'm going to go ahead and prime this. So because this was in a sterile packaging and I have not touched the hub, we don't have to scrub it. So I'm just going to grab my sterile flush and hook it on there. And we're going to prime it. Looks great. Okay. So I'm going to place this back in its sterile container, making sure it's not touching any other surface. Everything over. Make sure it's within reach, so that way whenever I'm doing my IV, I've got it here next to me. So we're going to go ahead and open up our IV catheter. And I'm going to make sure that our IV cap comes off. Looks great. Make sure that the bevel is up. And I'm going to scoop it into here. Okay, so I'm going to go ahead and just go over with IV again. What we're going to do, I'm going to make sure that everything looks good. I'm going to be sure not to touch anywhere that I have already wiped down, otherwise it becomes unsterile again. And we're going to go ahead and get started. Ivy, would you like me to count down? No? Okay, so we're not going to count down for Ivy. We're going to go ahead and tie this tourniquet back on again. Needle ready. Okay. Go ahead. I'm gonna move this closer to make it a little bit easier to grab. Okay, so I went ahead and got it uncapped. I'm not going to place my hand on the white because that is what pulls it back. So I'm just going to turn the arm over, make sure my hand's underneath of it and out of the way. I'm gonna go at a very shallow angle. Go ahead and inject the needle now. And I'm going to wait for flashback. I'm gonna advance it. Okay, so I now see a flashback, so I'm gonna advance a little bit further and push the catheter off and inject my safety. Okay, I'm gonna pop that tourniquet. I'm going to grab my J-loop and I'm going to put that on nice and tight. Okay. I'm gonna go ahead, I'm still securing that area there. I'm gonna take my piece of gauze and I'm going to wipe away any excess blood to make sure that it has a nice dry surface for our security tape to stick on. I'm going to take this piece of tape, place it on the edge. Okay, so I've got the tape on there to secure it. Dry up any excess area and make sure not to touch the catheter. Okay, so now we're gonna go ahead and aspirate. So I'm gonna pull back. Looks great. And I'm going to flush the area. Okay. Looks good. I'm gonna go ahead and take my, and I want to make sure that the catheter is within this window so that way you can see it. Place it on there. Are you still doing okay, Ivy? All right. Make sure everything looks good. And then we're gonna peel this tape up here off. Okay, I'm gonna make sure to seal it down around the edges. Okay, there we go. Looks good. Alright, so now I'm going to, now that I've made sure that that's secured down and the IV's not going to go anywhere, I'm going to flush again, and this I'm going to apply positive pressure to make sure to lock it in. So our IV is now locked. I'm going to go ahead and remove my flush. And I'm going to grab my piece of tape. I'm going to tape everything down. I'm going to go ahead over there. I'm going to take this label on the side and I'm going to date it and put my initials on here. And I'm going to put it on this side here. Alright, I'm going to remove the tourniquet from underneath the arm. And the IV is now placed. So everything in here is trash. I no longer need it. I'm going to throw the old needle into the sharps. Throw this into the trash. It's not needed anymore. All of this can be thrown in the trash. And I'm going to go ahead and remove my gloves and sanitize. All right. Throw my gloves. So I've done my hand hygiene. So the next thing that we're going to do is we are going to prepare our medication for the IV push. So this is going to be my second med check, and I'm doing it here while I'm preparing. We've gone over with Ivy what our next steps are, so I'm just going to go over again kind of while I'm getting everything ready. So what I've got here is I have my furosemide. This is 20 milligrams per 1 milliliter. Our order asks that we give 20 milligrams, so we're going to give 1 milliliter today. Got that there. I've got my red cap. Place that to the side. I've got a needle to draw up my medication, and then a sterile syringe to help draw that up. I've got 2 alcohol prep pads and a sterile flush. So I'm going to go ahead and get everything ready to go. So the first thing I'm going to do is I'm going to set out my needle, prepare my needle. So I've got my syringe here, and I've got my needle. I'm going to lock that in.
When I instruct you to do so, you're going to go ahead and
Put that in. Okay. And then open up my sterile flush, that way it's ready. I'm going to go over to that side. Okay. And I am going to take my alcohol pad, and I am going to scrub the hub of this just because it is a community vial. So for 30 seconds,
take a couple deep breaths.
28, 29, 30. Throw that away now. All right. So I'm going to draw up 1 milliliter of air. Okay. And I am going to remove my cap. All right. So now I'm going to inject 1 milliliter of air, being sure not to touch the liquid. Great. I'm going to advance further, and I'm going to go right up and down, and I'm going to pull 1 milliliter of liquid. I'm being sure to get rid of any air bubbles that I may have. One air bubble. Okay. Perfect. I'm going to engage my safety because I no longer need the needle. Again, make sure if there are any more air bubbles that came up that they're gone. Looks perfect. I'm going to get rid of my needle, and I'm going to place a red cap on. So my second med check is now complete. I've made sure that everything looks good, and I'm going to get rid of any trash that I do not need anymore. Okay. Alright, so my next steps are to grab my sterile flush, my vial, an alcohol pad, and then my furosemide. I'm first going to lift this back up while I go to the other side and make sure that it's locked.
Okay.
So now I'm going to my other tray here. Make sure I've got everything. Okay, I'm going to check in my vial, scan it, make sure that everything looks good, and now I'm going to go over my 7 med rights again. So, alright Ivy, so I'm here to administer your furosemide. So I'm giving Ivy Armstrong the furosemide 20 milligrams, which is 1 milliliter. I'm going to give it to her right now via IV push. We're going to do this one time, and then this is to help treat her gastroenteritis. So I'm going to make sure that I document everything that I've told you today before I leave, okay? So we're going to go ahead and get started. I'm just going to drop this side down, make sure we've got everything ready. So I'm going to make sure to look at the IV side, make sure that everything's ready. So it looks like this is locked here. We've got our hub, and we're going to go ahead and get everything ready to go. So I've already drawn up my medication, 20 milliliters here. I've made sure that there are no air bubbles, and it looks great. And I've got my sterile flush. So, okay, IV, whenever you are ready, we're going to go ahead and get started. So the first thing that I am going to do is I'm going to take an alcohol prep pad, and I'm going to wipe down this area for 30 seconds. So, this down, 28, 29, 30, release that. Okay, so now I'm going to just make sure that the IV, the peripheral IV that we have here is working properly. So I'm going to go ahead and open up my sterile flush. I'm going to lock it, and I'm going to start, I'm going to unlock, and I'm going to start by aspirating. Okay. Alright, looks good. I'm going to go ahead and flush just a little bit. I'm going to unlock, and while I have it carefully placed in my hand, I'm going to go ahead and take my medication. I'm going to uncap it, and I'm going to go at a rate of 1 milliliter per minute. So we're going to do this over the course of 1 minute. So a minute has gone by. I've administered my medication. I'm going to unlock this here, and I'm going to take my sterile syringe, and I'm going to repeat this flushing over the course of 1 minute, just at the same rate that I was giving the medication. So 1 milliliter per minute. Nice and slow. So after I've made sure that all the medication has been pushed through, I'm now going to make sure that I lock it into positive pressure. Alright, it's all completed, so now I am done administering the medication. I'm going to lock up this here. I'm going to grab all my supplies. And I'm going to make sure I lock the bedside. I'm going to go ahead and grab my supplies. I'm going to go to the other side here. I'm going to throw away everything that I'm now finished with, making sure to hold on to this vial. All the sharps have been placed into my sharp spin, and I'm going to go ahead and wipe down all of my areas. So. I'm going to perform hand hygiene. Alright, Ivy, so we have completed your peripheral IV and your furosemide administration using IV push. Is there anything else that I can help you with today? Okay, so we'll go ahead and make sure that we get your collate placed in the right spot here for you. So with your left arm, I'm going to go ahead and lower your bed, and I'll be back to check on you in about 2 hours, okay? Alright, so while I'm lowering the bed, I'm going to make sure that all of my supplies have been thrown away. That IV is in a comfortable position, everything looks good. I'm going to grab any supplies that I need, and I'm going to be sure to document everything now that I'm finished.